Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
If you have any further questions or comments. So let's move on and talk a little bit about what our goals for the session are. I want to cover, first of all, breast coding, and I'm breaking that down into two categories. One is cytopathology, breast specimens, and then also breast tissue specimens, specifically what are the ways that CPT breaks those down and the various codes that you have for that. I'm going to go over at that time intraoperative consult coding because that's something that you'll often see in association with breast cases, although clearly that's something that occurs in a lot of different contexts, but we're just going to tag it along so you'll be aware of that and how to code for that. Then we're going to look at gynecological specimen codings, uterus and ovary codes, fallopian tubes, a vagina, et cetera. But we're going to look at how diagnosis coding specifically impacts your choices for your procedure codes, which isn't the case for everything, but it does have a large impact when you're selecting your procedure code for gynecological specimens. And in that context, then, we're going to talk about when do you have separate specimens. This is something, bundling rules can get very confusing, especially in the gynecological specimens, that really can cause people to drop opportunities for separate specimen pay. So we're going to look at how to manage that. And then also sort of an adjunct service is and again, this is something that happens for lots of different specimens, but I'm going to tag it on specifically with the gynecological specimens because there are very specific things that pathologists do sometimes to prep tissue for other studies, molecular studies, et cetera, and you want to be sure that you capture those codes and the pay for those services when your pathologist performs them. And similarly, ancillary services, stains, IHC, ISH, and that sort of thing. So that's really the scope of what we're going to cover today. So let's move right along and start with breast cytopathology. So what are we talking about with cytopathology? Well, we're talking about a cellular specimen, not a tissue specimen. So in this case, it's aspirated cells. Those are cells that are removed via a needle, and there's really two contexts in which the surgeon will do this. If there's a fluid-filled breast cyst, the surgeon may do a puncture aspiration, which they sticks in the needle and withdraws the fluid. And you can see there I've put the surgical procedure or the name of the procedure as the surgeon would call it out. The other is a fine needle aspiration, and that is different because it's not a fluid-filled cyst, but it's actually a solid tumor in which the surgeon, or in some cases the pathologist, will insert a needle and withdraw some cellular tissue, or some cellular specimen. It's not tissue. It's actually just cells mixed with fluid. And so those, you're going to need to know really which specimen you're looking at. The pathologist receiving cells from breast, unless it's designated that it's from an aspiration, cyst aspiration, or an FNA, you really don't know. You can't really tell by looking at the specimen what it is. You have some cellular tissue, but it does have a big impact on how you code the procedure. So you're going to have to look at the op note to see exactly what the specimen is that you're dealing with. And if we move to the next slide, I'm going to talk just about the cytopathology from a cyst puncture aspiration. If you have an FNA specimen, you're not going to be using these codes. You're going to use a separate set of codes. And that's why it's really crucial to understand what the specimen is before you start trying to code it. So look for puncture aspiration or evidence of the surgical procedure or something that will lead you to choosing one of these four codes for reporting your.
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.